Okay, so hey, here we are. It's Ben and Gary show. We know dentistry. This is episode number 25. I cannot believe how many we've already done, but your questions keep coming, and we have the answers. So, what is the one this week here, Gary?
We're going to talk about reasons for dry mouth and what causes it.
It's such a common thing. I mean, I think we treat many times patients who are advanced in life, and we kind of get common questions that come up, and one of the more common ones is that my mouth is always dry. They keep a glass of water at the side of their bed,
right,
but yet it still doesn't help. It's just like I'm just completely dried out. And so I thought it would be good. We thought it would be good to be able to answer that question and kind of go down a few things that commonly cause this.
Right.
And first thing kind of comes to mind is that just as you kind of advance in life,
as we get older,
salivary flow kind of goes down a little bit.
Hate to say that, don't
yeah,
we?
Yeah, and
we're getting older.
And I believe that it's a rare occasion when we have patients who are advanced in life who aren't on at least a few medications on their medical history forms, and some of those ones that really can cause and could promote the dry mouth.
Right.
And that's probably the drugs that are in the families of the diuretics, where if you have hypertension,
right,
those are going to dry you out. But there's a litany of them. I would actually advise you just to simply just Google medications that cause dry mouth, and I can guarantee you will have many hits on that.
It's
so
surprising,
and even surprises us at times there. So we have to sort of get out our notes and kind of really go through some of these meds that that can cause these things. But at the end of the day, how does it manifest itself in dentistry? How do you see it in your patients?
Well, what I see is that it creates a perfect environment for bacteria to multiply and cause tooth decay, and especially along the gum line. So
as you get long in the tooth,
right,
as they say,
and so then we see, we fix that, we treat the decay, but oftentimes the next time they come back, we'll see a recurrent decay.
Yeah.
So it becomes a vicious cycle. So we often will prescribe fluoride treatments or fluoride trays, and if they chew gum, we often recommend gum that contains xylitol, because the xylitol takes up the receptor site of that what sugar would normally take up in the bacteria, so it helps decrease the rate of caries or decay.
Yeah, the chances of being able to get root decay, which is like the worst, you don't want that. And the fix for that is something that isn't necessarily going to last, like what we would like, so sometimes it becomes the most expensive thing that we have to do is put a cap on a tooth. And and if we can avoid that, that'd be great. But still, even then, dry mouth is still a problem, because just because you have a cap on a tooth doesn't necessarily mean that you can't get decay around that same cap again or that same filling. So it's a tough thing to deal with.
Right.
So often what we have to do is there's some over-the-counter products that can help promote saliva flow, or kind of artificial salivas. Again, like you just mentioned here, if you're going to use something that's going to help promote that, like something that's lemony or something like that, you basically make sure that you don't have any sugar in that. So that sucking on something like that, which it has sugar in it, really defeats the purpose, because when you have to decrease salivary flow, chances of decay rise. And saliva is a buffer in your mouth. It's slippery and it makes the bacteria slippery, which the plaque is not slippery. It's sticky. So it buffers it. It dilutes the process that that bacteria would promote the tooth decay, and then just in general, the gum tissues just don't like to be dry.
Right. So it also comes down to your personal daily hygiene. Toothbrushing or using a mechanical toothbrush, such as an Oral-B or Sonicare, and of course flossing. And that story that came out last year about don't floss, we don't buy that.
That's like Bizarro World type of backwards.
Yeah, so I mean, you definitely want to floss and keep everything as clean as possible. So brushing and flossing twice a day, or 3 times a day after each meal, even, right? So definitely. But then you're right. The diet has a lot to do with it, and we'll also ask you to stay on a very healthy diet. And
dry mouth is not really good in terms of you get into the aura of what that might actually smell like, by the way, here, because a dry mouth does not promote fresh breath, let's just say. So saliva, we take it for granted, but it's so important. And it's a major factor in being able to maintain your teeth for life.
Right.
So be sure that you tell your dentist if you feel like you're having that problem. And if they actually mention that to you and you're not aware of it, take them very seriously, because they're seeing things before you can actually be aware of them.
Right.
So remember that as we get a little older, your salivary flow does kind of decrease. Talk to your dentist about ways in which you can counteract that. So again, hopefully that helps with being able to answer the questions about dry mouth and what can you do about that. This is the Ben and Gary Show. We know dentistry. See you next time.
Take care.